Hi folks, it's Dr. Christine Sauer here with Sparkles for Mental Health. And I'm very excited today to have a really experienced person here. His name is Dale Walsh, right? No, Dale Walsh. Yes, Dale, sorry. And Dale has experienced schizophrenia for 47 years and has grown up to become a poet, mental health coach, and financial educator. What a story. Dale, just for clarity, I myself have been diagnosed with schizoaffective disorder. I've completely recovered. I'm fine now. I was fortunate it started later. My son is a paranoid schizophrenic. Okay. It certainly takes a toll on somebody's life. Tell us about your story. When did it start for you? What were your hopes? What happened?
Well, thank you very much for having me, Christine. It's a pleasure to be here, and thank you for giving me the opportunity to tell my story. And so I was diagnosed. I went, well, to begin at the very beginning. I was born in Midland, Texas. My mother divorced my father, and the divorce apparently was finalized on my first birthday. And I went, so she remarried, and I had a second father who was the only father I knew growing up. And I was in Abilene, Texas. I had an ideal childhood. It was like an idyllic situation. And so at the age of 10, my mother met another man, divorced and remarried. And I went from Abilene, Texas to Midtown Manhattan. And that obviously changed my life and my whole perspective and everything. So I went to boarding school in New Hampshire for 4 years, and I ended up at Dartmouth College. And I had a very successful freshman year, despite the fact I was doing drugs every day. I was like a marijuana addict, and did hallucinogenics and everything. And I really think that's the reason that I mean, my mother had a mental illness that was never specified what it was, but I think I had biogenetic predestination, disposition to mental illness, and I think the drugs just basically the thing that threw me over the edge. So, what happened at Dartmouth was I came up with what I thought was a great joke, which was, "Hi, I'm God," and so I was like walking around campus telling everybody my hilarious joke, because how could God be 5'8"? So. I was doing this for about a week, and then one night the campus police came in and they said, "Are you Dale?" And I said, "Yes." And so, long story short, a week later, or actually 4 days later, I was in a mental hospital in New York City for 13 weeks, and with the diagnosis of schizophrenia, and that led to a program in New York.
Tell us a little bit about that time. The first time in the mental hospital. How did they treat you? How did you feel? What did you do? Because many of the listeners have never set a foot in it. Now I know what's going on. I was myself, but right. Many of the listeners don't.
Okay, well, basically, when they took me away from Dartmouth, I didn't really know what was going on. I mean, I didn't know what was going to happen. I knew what was going on, but I didn't know what was going to happen. And so I spent the night at my parents' house and at my parents' apartment. And and the next day they took me to a building, which was the mental hospital. And I sat down with the doctor, and we had a very nice conversation. And my mother was always like very proactive when it came to psychiatrists and everything. So. The doctor put a paper in front of me and said, "Sign this, Dale." And I looked at my mother, and she said, "Sign it." So I never argued with my mother. So I signed it, and my parents got up to go, and they went left, and I went left to follow them. And Dr. Cohane said, "No, Dale, you come with us. You come with me." So I was like put on a locked unit for 13 weeks, and it was a real menagerie of characters there. But as I said, I was basically going with the flow, and I knew that my life was changing, but it was well, I guess the easiest way to say it is it was a completely life-changing experience. But uh, I would talk to my doctor and I'd say, why am I here? There's nothing wrong with me, which is a classic symptom of schizophrenia. But he said, well, if you broke your leg, Dale, you come to the hospital, yes? And I'd say yes, and he'd say, well, you broke your brain. And this this simple statement that he said one time like haunted me for the next 35 years, because I was convinced that there was something like terribly wrong and I would never be able to be healed or recovered, even as I was like graduating from college and doing all sorts of major things. But so uh, actually my roommate's name was Gabriel, and he was like this big Argentinian prophet type who had had like a half his brain removed because he had a brain tumor, and so that's why he was there. And so I very rarely got down on myself or depressed because I was in the mental hospital, but it was like it was constant like consciousness of survival. And she was like, what am I doing here? And everybody.
Now, when you were in a mental hospital, what do you do all day?
Well, basically, we would have like physical therapy. That there was like a big game. The ninth floor was like a recreational area, and so we would play volleyball. But basically, you're just like killing time. You're just like seeing the doctors, taking your medication. It gets to a point where you're judging your days, or you're measuring your days by medication time. And also like meals and everything. And so
Did you ever pace the floors back and forth? Because I did that when I was there.
oh sure, and you pace back and forth. I mean, there's really nothing to do most of the time. I mean, they have activities. I mean, when I came to New Jersey, I was hospitalized 14 more times. And I got very comfortable in the hospital, and I sort of used it as a getaway from the intensity of the program. But basically, so you know, we would just socialize. I did a lot of reading. I got my typewriter and I was writing poetry, which has always been one of my main focuses and hobbies. And it's more than a hobby actually,
Wow.
but
What kind of poetry did you write, or do you write?
well, at first my poetry, well, I should start by saying, Dr. Christine, that on my 10th birthday, I decided I was going to be a writer. So, writing was always like my main focus. And when I got my typewriter, I didn't have any ideas for a book, but I just wrote poetry as therapy, and like explaining to myself what was going on, and how I was perceiving. And everybody liked the poetry a lot, but and that also killed time. But basically it was just like people would sit around and eat fruits, or or something, and watch TV. I never watched TV, so I always had to occupy myself. But it was just like a sedentary life of watching TV, going to meals, and getting medication.
Yeah, most people don't know what's really going on there inside. There's not much going on. Did you ever have a psychotic break where you acted out, got angry, or had to be confined to the QT room, quiet room?
No, I was never put in a quiet room.
Yeah.
But
Many people don't know that there exists one.
right. Well, the quiet room was for like people who were like aggressive or violent, and it usually involved like five to seven security guards, and a emergency shot of Haldol or something. But that never really happened to me. But yeah, the thing about mental hospitals is everybody has like this, this negative view of it, and I guess it is pretty negative. But the bottom line is you don't do much. You just like have to kill the time, and hope you get better. And, everything's arranged around sessions with the doctor and everything.
Yeah, and for some people, it is kind of a reprieve from the stress of everyday reality. Was it that for you?
Yeah, well, especially when I was in a psychiatric program for young adults and adolescents for 5 years. And during that time, I was hospitalized 9 times, and it was always the same hospital. And I became very, like, not only comfortable there, but also familiar to all the doctors and the nurses and everything. So when I would go to the hospital, it'd be sort of like a homecoming, just like, I'm here.
Yeah.
And but actually the hospital in New Jersey was like much more focused on like keeping patients busy, and had a lot of activities and everything. But I definitely used it as a sanctuary from the pressure I would feel being surrounded by the same group of people talking about therapy 24 hours a day, 7 days a week. And it was just like such it was like a good atmosphere, but it was like a therapeutic atmosphere, but it was just like too much for me. So I would, it would cause me to go psychotic, and then I'd be put in the hospital for 2 weeks, 2 to 6.
Oh, wow. That must have been frustrating.
It was. What was most frustrating is a lot of times when I got put in the hospital, I felt that I was like reaching a new level of enlightenment, or of clarity, but the doctor would see it differently and say I was going psychotic. So the doctor was very good, but we definitely had like philosophical and behavioral differences about what was reality and what wasn't.
And sometimes those are actually founded in reality. Sometimes I feel even when you're labeled as a schizophrenic, it's not necessarily schizophrenic, because some people that did great things in past years, in past centuries, would maybe now end up in a mental hospital.
Right. Well,
but there's certainly people that have a complete break with reality and are better off in a hospital. And a modern hospital is 100% better than the hospitals were 200-300 years ago.
Absolutely.
When people were chained, lobotomied, and given cold water treatments and draconic stuff like that. That does not happen in hospitals. And what you see in Over the Cuckoo's Nest does not happen like that.
Right. Well, I think Hollywood has like a very jaded
Yes.
view of hospitals, but some hospitals aren't good. They just like leave you in a back unit, and one thing I'm most proud of, Dr. Christine, is I was hospitalized 15 times and I got discharged 15 times. So
that's it. And how long how long ago was it the last time you were discharged?
29 years.
Wow.
It was 1993.
So let's go back. Your journey started, like for many people that have a little disposition, genetic disposition, as you said, to have a psychotic break with drugs. My own son got schizophrenic after he was into marijuana heavy, just like you. That happens a lot. That's why I always say marijuana is not good for young people.
Right.
But after 15 hospitalization and discharges, 29 years ago, you never had to go back to the hospital. What do you think the reason is for that? Amazing recovery.
Well, first off, after being in the program for 5 years, I went back to college and I got my degree. I graduated magna cum laude in English from Fairleigh Dickinson University.
Wow.
But that I was at Fairleigh Dickinson as a student for 5 years, but the first 2 years I was basically alienated by my illness. I would tell everybody I was a schizophrenic, and they would all basically run away. But I learned I relearned social skills. It was like a whole process where I basically had to learn again how to be around normal people. And
there's no normal people in my books.
Right.
There's people.
Well-adjusted or non-neurodiverse or whatever you want to call them. But so you know, that was like really where my recovery began, because you know, getting back into a normal situation of like college students, and you know, being able to talk about like say Plato and Nietzsche, rather than about like when am I going to go to the hospital next, was like a very liberating situation. And
Absolutely.
you know, but the foundation was laid at the program for my recovery. And then after graduating from Fairleigh Dickinson, I started my own business as a tutor, helping people write college papers.
Wow.
So that's how I supported myself. And then I got disability for, you know, I used to say the government pays me to be crazy. So
Well, I mean, to some extent, it makes sense because the disease took a large amount of your life.
right. But so I also was writing poetry and doing the tutoring. And then about 4 or 5, you know, about 3 years ago, I came up with what I thought was another brilliant idea, which was, why don't I use my experiences and my knowledge of schizophrenia to help the families of those who, because as you know, Dr. Christine, you know,
Me,
when
Christine, it's fine.
okay, okay, Christy. But as you know, Christine, when psychosis hits, there's no way to prepare for it, and it comes out of it's like a lightning bolt out of the blue every time, and you know, it can destroy families. And I realize, you know, my parents were very strong and they helped me and everything, but but you know, I know how much pain I caused them, and how much they struggled with my illness, even when I wasn't struggling with my illness. I mean, my doctor diagnosed me, gave me a diagnosis of psychotic bliss. So I was in bliss all the time, but you know, it was like tearing up my family. And so, you know, as I got more aware and more insight into my illness, I realized how much I'd hurt my family, and I wanted to rectify that with as many people as I could.
You know, that is really amazing. So now you are coaching the families of schizophrenic or also schizophrenic people themselves if they want to hear from somebody that knows it.
I don't deal with the patients themselves. I leave that to the professionals. But
Mm,
you know, I just I give people, you know, I try to give people hope. You know, I use myself as a role model. I said,
yes.
you know, I've come out of this, but it took like a long time, you know, and a lot of people are very impatient, and you know, and they don't understand that, you know, schizophrenia. I used to say schizophrenia is a life sentence, it's not a death sentence. So you know, but you know, just being able to like understand the illness, I think, is like essential to not only keeping your own peace of mind, but also helping your loved one to recover.
Yeah. Yeah. So what do you think, what does recovery from schizophrenia look like?
Well, self-sufficiency, you know, being able to, like, I mean, most get to, I've been very fortunate in that, in my journey, in that I've had my own apartment for 41 years, you know, and that's pretty extraordinary for a schizophrenic. But you know, but just what I say is, you know, that the definition according to the Greek of schizophrenia is shattered mind. And so what I feel recovery is you take the parts of your mind that are shattered, and you put them again into a new gestalt where you can cope, and you can really like understand not only yourself and the illness, but also, you know, live in society. And that's one thing that I'm proud to be able to do. But you know, I have friends who are schizophrenics, and when I was first diagnosed, they would say that 33% of schizophrenics get better, 33% stay the same, and 33% get worse. So, you know, I just try to give hope. And, you know, as for your question, shattered mind, you know, you really have to like, it's sort of like, you know, breaking a vase or something. And you can like do it with gold and you can put it back together with gold and make it stronger, or you can like just like throw it out. So I think that's what happens a lot, is that people get so discouraged because it's such a slow path sometimes that they just throw the broken, shattered phase out instead of like sticking with their loved ones. And that's one thing I want to help people with.
You know, I really love that attitude. So when you talk to the families of loved ones, often young people, their lives is disrupted by their terrible illness. What are the main issues that those people have? What those people face? The parents see, oh my God, my child is totally recluse in his room, writes all day or is completely out of it. And he doesn't even want to go to the hospital or the doctor because he thinks he's fine.
Right. Well, I'm sure you know the term agnosognosia, Christine, but that's agnosognosia is Dr. Amador, Xavier Amador is like the expert on that, but he wrote a book called "I'm Not Sick and I Don't Need Help," and that explores agnosognosia, which is a term from neurology for stroke victims who don't realize they're sick. And it's not like they're in denial because they just can't comprehend that there's anything wrong with them. So, you know, that's one of the things I address with my clients is, you know, how to deal with agnosognosia, and like, you know, through empathetic listening and, you know, and through just being open to conversation and being without judgment about your loved one, you know, because, you know, I'm at, in an extreme case, for instance, you know, a schizophrenic will say to his mother, "You aren't my mother, you're a demon, and I'm God." So, you know, I mean, how you know, and the react the normal thing is to react and say, "Of course I'm your mother. How can you even say that?" But rather than saying that, say something to the effect of, "I understand you don't believe I'm your mother, but could you tell me why? You know, where's this thought coming from?" And you know, to get the background on the thoughts and to like really like help people understand not only themselves as the loved ones of the schizophrenic, but also the schizophrenic himself.
Yeah, no, in the public, there's often that notion that schizophrenics are the people that commit crimes, but it's not true. Most schizophrenic never commit a serious crime. But there are those that go untreated for way too long. And sometimes it can help for a relative when their loved ones goes too wild to call the police, have them committed, as hard as it may be.
Well, I have a group that I sort of attend once every 2 months. It's a family group by a mental health organization. And you know, I just is, you know, people tell us stories and everything, and I think of like one man who has been like the sole guardian of his schizophrenic son for the last 30 years. And he was talking about how, you know, how his son was realizing they couldn't live in the house after his father was dead and everything. So, but you know, that incremental buildup of insight is like crucial to recovery, because you know, basically if you're psychotic, you're in a dark pit, and to be able to feel your way out takes a lot of illumination from other people.
Yeah, I really like that. I really like that the way you say it. And I know sometimes it just gets too long. And I remember we were in Germany years ago, and we were called for house call to a patient. And her parents called us because she was breaking windows and she was totally out of it. She was schizophrenic and threw stuff around, destroyed everything. And we actually had to call the police and have her committed. And when she came home, she was treated and everything was fine for the longest time. So I think medication and good treatment can turn a life for the better. What are your opinions on that?
But the the dilemma at this point is that the mental health system is so overwhelmed. I mean, especially with COVID. I mean, like COVID brought out like mental illness out of the closet, because all these people who had been so busy, like controlling their lives with work and family and everything, when they had nothing to do, they found out that they, had a diagnosis. So the problem is, I mean, the problem as I see it is, and I don't know what the solution is, but the doctors and the social workers and the psychologists and the psychotherapists, they're just like totally overwhelmed by their caseloads. So medication becomes the go-to answer. But without talk therapy and without the care of a real physician, then you're just like shooting in the dark, and people aren't going to take their medication, and because of agnosignosia, and they think there's nothing wrong with them, and it's like a snowball effect. And it's all because there just are too few doctors and workers to like deal with the overload of cases.
Yeah, no, I agree. And I think the COVID overload was mostly caused by people developing uncontrollable anxiety and depression more than schizophrenia, which is a disease, I think, that needs the most attention of all.
Well, it's interesting you say that, because I've been on a more than a few like mental health podcasts, and in most cases I'm the first, or mostly the first, but at most the third schizophrenic that people have ever like interviewed. And that's really what my mission has become, is to be able to like explain the illness to reality, to the social world. And so I mean, schizophrenia is probably it's definitely the most expensive psychiatric illness there is. I mean, more
per person, not totally, because there's a very small percentage of mental health patients are actually the schizophrenics.
Right.
But those, I think, deserve the best treatment, and they need it.
Well, that brings up another point, which is, that is, I think that when I was first diagnosed, they stuck to the regimen that you had to show symptoms for 6 months before you could be diagnosed as a schizophrenic. So I did, and I got the diagnosis. But I think that the schizophrenia as a diagnosis is just thrown around too easily these days, because someone can have like a bad drug experience, come to the hospital, and they and within 2 days they're calling him schizophrenic.
Not good.
And that creates the stigma of mental illness for the person. And it's just like, but I think that a lot of people I've encountered in my coaching are I don't think they're true schizophrenics. I think they're like traumatized, or drug induced, and a lot of them, once you get, I mean, like a lot of students at college who got into drugs like I did, and but once you get them away from the stimulus of the substances, then you see they aren't schizophrenic. They were just toxic from the substances.
Yeah, and you would hope that the doctors recognize it and then slowly taper the medications off and not just withdraw them, because then you get the withdrawal psychosis, which then they say, oh yeah, I knew he was schizophrenic, but it's not true. I've seen that too.
Well, actually, that was responsible for some of my hospitalizations, as I would stop taking my medication, and within 2 days to 2 weeks, I would be back in the hospital. And it was very frustrating for me, because I would get off the medication, and I, like, as I say, reach that new level of clarity, but then they put me in the hospital and shoot me full of, like get me back on medication. But ultimately it was all for the good, because I'm very reconciled to my medication now, and I thank the Lord that I found the right one, which is another issue that's coming up these days, because the pharmaceuticals are producing so many different drugs for psychosis and schizophrenia and schizoaffective now, that the doctors just can't keep up, so they have to like follow the dosing suggestions of the manufacturers, who really have no place in like telling people how they should take their medication.
Yeah, that's one thing. And then sometimes it's not checked. Do they take them? And sometimes the side effects are not properly checked, and they do have side effects,
Right.
even the modern ones. And I'm sometimes horrified. I see people that are depressed and they are put not just on an antidepressant, but at the same time on an antipsychotic. I think that's so wrong.
Right.
But that is done. And I think they overdo it a little bit. And I've even heard that they use antipsychotics for kids. And they are not schizophrenic. They just pester the parents. Say parents need parenting advice. They don't have time for it. They complain about the kids get antipsychotics. I think that has put the antipsychotics maybe in a bad name. Antipsychotics are life-saving and life, like for schizophrenics, absolutely.
Right. Well, the thing about that is when you first get on antipsychotics, they make you feel terrible. That's the bottom line. I mean, until your body adjusts and gets used to it, then it's not going to it's going to be detrimental. You're going to think it's being detrimental to your health. But the fact is that, you know, after like 6 weeks, if you stay on it, then you know you begin to get better, and the medication really starts to take effect and everything.
Yeah.
And that's what you want. But you know, a lot of people are so impatient and you know so out in lack of comprehension of their illness that they you know they don't they won't tolerate the medication for long enough to take effect.
Mm. So tell me a little bit about what you're doing now and how people that are interested in your coaching services can reach you.
Well, my about a year ago, a good friend of mine approached me and told me about this opportunity for being a financial educator. And yeah, I joined the company right off the bat. I figured that I could integrate this financial education into my coaching business and like really give people a complete package of like, you know, not only psychic and emotional support, but also finances, because as you know, Christine, schizophrenia can be very expensive. So
It can be expensive and it can rob you of much of your income bearing years where
right.
you usually build your retirement and money. So I think financial health is an important part of health.
So I joined this financial education company, and our goal is to eliminate financial illiteracy in the United States and to give the 98% of Americans who can't afford it access to financial advisors. So this is, you know, this has been a job where I can like fulfill my desire to serve people in a way that is like very positive. And you know, we help them get life insurance and cover themselves for unexpected events and everything. And we also like give them counseling about how to like, you know, increase their disposable income and stuff.
Okay.
I have been doing that for about a year. And in fact, I just came from the convention last week in Las Vegas. And that's another thing that I've improved is for the longest time, I couldn't leave Hackensack. I was like agoraphobic about Hackensack. And, you know, in the last 2 months, I've like taken a trip to Lake Tahoe with my team. And then with my company, I just had the convention. So, I'm very happy to be able to like have the wherewithal to be able to, you know, do this financial literacy and to help people. And my website is www.dewlivelove.net.
Wonderful. I will make sure that it's under the video and in all text with the podcast, so people can get it and can contact you.
And I also have a phone number they can contact too.
Okay.
It's 201-509-0871.
Okay, by all means, contact Dale. especially if you're somehow affected by mental illness, and many people are, and need financial recovery too, because financial health is important, and you know that. Dale, I thank you so much for sharing this inspirational story, and it gives people hope. There's recovery possible even from serious mental illness.
Well, that's my goal, is to just give people hope and let them see that it's not a totally black situation, and there is a light that can be shown on the whole situation.
Now, if for the end of the podcast, if you could tell the listeners in one sentence, one thing that you would give them advice, what would it be?
Be patient, have faith, and live love, and let love reign.
Wow, I love that. Thank you so much for being on this podcast, Dale. And let's sparkle for mental health. Bye-bye.
Thank you very much for having me, Christine. I really appreciate the opportunity.
Thank you, Dale. Bye-bye.